orientation video for the medication and crash cart room. In this room, you'll notice that you have several different things. You have your crash cart here. You have cabinets, drawers along these two walls. And then you have your linen cart in here, as well as your medication dispense cart, which we will cover in a different video. So in here, we'll start with the crash cart. This is where the crash cart will be housed for high fidelity simulation. So if you are needing to have the crash cart as part of your simulation, you'll need to send someone to this room to get the cart and bring it back to the room that you need it in. This is a live defibrillator here, so it does deliver real electricity. So all of your sequencing and your requirements for a code, which you will have already been taught, do go into effect when you're using this. It does connect to the mannequins a little bit differently. You have these wires here that are known as the hands-free, pad-free defibrillation kit. These will attach to some pre-mounted monitor areas on the mannequin, which you will see later on. You will be instructed on how to use this equipment inside your class instruction time if this is going to be needed in your simulation or your clinical. On the crash cart, other than the defibrillator, we do have an ambu bag that has a oxygen connection. So if you're in a room with an oxygen connection, you would plug this in and then utilize this for giving breaths. And we also have a portable suction machine with your tubing and your Yonker suction. This can be used in case you're not in a hospital room, maybe you're in a restroom or a hallway or outdoors where there's not central suction. And so you'll have that, but you do have to have power for both of these to work. On the front of the cart, you have several drawers. You have your lock code on here. This cart is to remain locked, and so you will have to break this code, break the seal as part of the process of getting into the cart. And then you will find your code medications as well as syringes and needles and IV tubing and IV fluids in the cart, as you would for a regular cardiac arrest. I will note that these are your pads that you would normally use on a patient in the hospital. We do not use these, as your wireless hands-free kit replaces those for the mannequin defibrillation only. Next, we'll move around just to orient what is in the room. On the lower cabinets and drawers, they are labeled to what you will need for your simulation. This is all of your tubing is on this side. It is labeled for either pump tubing, piggyback tubing, or regular non-pump primary tubing. And you also have your syringe pump tubing is here. Along the back wall on the drawers, you have your needles and your syringes, and they're labeled appropriately. And then any stock IV fluids, meaning IV fluids without medications in them, will be located in these two lower cabinets. The upper cabinets on this far wall are for storage only. Those are not part of the simulation, and you will not find anything there that will be needed for any of your simulations. On the counter here, we have a couple bins. One has tape in it now. We have alcohol pads. Your medicine cups are here. We also have your injection pad. It may look like this, or it may be a small round pad. This is to use with your simulators when needing to give an injection. So if you are doing a sub-Q or an IM injection, you would take this to the mannequin, give the injection on the location that's needed in the pad in the correct technique, and then you would return the pad in here. Because the mannequins do have a lot of mechanics in them, they don't have injection pads on all of them. So we would prefer that you use the injection pad for that. You'll also have a calculator here. Some type of drug book will be here, along with any other medication-related supplies that you may need.